Good morning, everyone. Welcome to the COVID-19 media briefing. I'm Carrie Schurig, the Public Information Officer for the Shasta County Health and Human Services Agency. I'll start like we always do with the numbers. The statistics from November 22nd and 23rd, Sunday and Monday, we have a total of 4,470 confirmed cases, including 214 from Sunday and 109 from Monday. That Sunday number probably includes some from Saturday because there was an update to the state database that that held some of those numbers back. But now we're all caught up. We did a total of 745 tests Sunday and Monday. We've had a total of 85,138 tests, including about 80,000 that have been negative. We have an estimated 760 active cases, which includes people who are in isolation and also hospitalized. And we have had 43 deaths. Today with us, we have Robin Schurig. She's the director of the public health branch of the Shasta County Health and Human Services Agency. And Dr. Michael Vovakes is our deputy health officer. We also have Robert Folden from Mercy Medical Center, Reading. Does anyone have anything to start us out with today?
I have a couple of things. This is Robin. First, I just wanted to mention that we are encountering lots and lots of work sites who are experiencing cases. Oftentimes, those employees are exposed outside of work, but are just having to miss work, either because they are sick themselves or because they have been exposed and are on quarantine. I just want to remind folks that there is lots of information on our website about ways in which employers can protect the health of their employees in the workplace. So if you suspect that there might be, disease spread happening at work, there are lots of things that can be done. And I'll just use my own work site as an example. In the Health and Human Services Agency, we are ensuring that employees self-screen before they come to work so that if they have any symptoms, they stay at home and don't spread it to others. When they do come to work, we are making sure that people are distanced at least 6 feet away from each other. We are also requiring that employees wear masks at all times when they're at work, with the few exceptions of if you're in a room by yourself, like I am at this moment, or if you are in a vehicle by yourself, or when you're eating, you obviously need to remove your mask to eat, but you also need to make sure that you're at least 6 feet away from other people when you do that. And then for certain of our employees, depending on what tasks they are assigned to, so for example, children and family services workers who are going out into the community and into people's homes, or nurses in our public health clinic who are administering vaccines and other things where they have to be within 6 feet of clients, they are provided with more personal protective equipment than just the mask. So they might be wearing gloves, gowns, etc. So those are some things that we do to protect our employees, and there's lots of information on shastaready.org about ways in which various types of employers can protect their employees. The other thing I wanted to talk about briefly is the state's modified stay-at-home order. This is the order that came out last week that requires folks to stay at home unless they're doing essential activities between the hours of 10 p.m. and 5 a.m. And most of the media coverage around this issue has centered on all of the local law enforcement agencies throughout the North State who have come out publicly to say that they are not going to enforce this order. And so I just want to address a couple of things related to that. One is that there is enforcement from the state for businesses who are not essential and are staying open beyond those hours, as well as all of the other requirements that have been placed on businesses by the state. Certain businesses are supposed to be closed. Some of them are supposed to be serving only outdoors. Some of them are required to reduce their capacity, etc. And there is a state enforcement task force that is made up of agencies such as OSHA, ABC, the Department of Food and Ag, the Cosmetology Board, various regulating entities at the state level. And they are doing enforcement. We receive reports from them daily that tells us what types of businesses they've either visited or called or sent letters to in our county. And so I can tell you that there have been about 36 bars and restaurants visited in person by ABC just in the past week or two. So they are doing enforcement. They are out in full force, especially in counties like ours that are in the purple tier. and they can impose fines, they can pull licenses, they can take court action against businesses as well if they are not complying with those requirements. So there are consequences for businesses that are not complying. On the individual level, no, you're not going to get a ticket or get a fine or get arrested if you leave your house after 10 p.m. Or if you fail to wear your mask, but we still ask that people do those things. So we're asking people to stay home as much as possible, not just between 10 p.m. and 5 a.m., but as much as you can, stay at home. When you do go out for essential activities, wear your mask, keep your distance, wash your hands frequently, all of the things that we've been saying for months and months. And the reason isn't because we want you to be afraid that you're going to get a ticket or get arrested, but the reason is that these activities protect your fellow community members. And the more that we can have people doing those things to protect each other, the slower the spread of disease is going to be. And if we can get our case numbers down, we can hopefully eventually get out of the purple tier, and businesses will be able to be open more, as well as just a reduction in illness and suffering among our community members, and hopefully a reduction in hospitalizations as well. That's all I have to share.
Thank you, Robin. Anybody else have anything to start us out with before media questions? Seeing no green lights, we are ready for media. Oh, just kidding. Hi, Robert.
Well, I was wanting to give Dr. Vovakes a chance, but I just wanted to comment on a point that Robin made, and that is as we see this surge in community cases, what we know is that there's always a lag time between a surge in the community and increased hospitalizations. And we were fortunate to access some models here recently this week, and with our given surge, there's a real genuine concern that come the middle to end of December, the hospitals could see a significant number of COVID-related admissions. So I think my plea would be this to the community, and that is, you know, the more that we can do some simple things like wearing of masks, some distancing, hand hygiene, and cleaning, the better prepared we're going to be as this continues, because the science is real. I mean, this virus is going to continue for a while until we get some vaccination and until we're able to sort of bend that curve, but we're back to bending the curve the wrong way. And unfortunately for vulnerable populations, it means hospitalizations. So while younger people may fare well, older people may not fare well. So what we do today sort of impacts others 3 to 4 weeks down the road. So I'm looking at Christmas time and the potential of anywhere from 40, 50 patient admissions upwards of 100, depending upon the model. So that's kind of daunting for us. As such, we continue to have reduced visitation. We do allow minimal visitation right now. And then we have reduced many of our surgeries. And I think that's the other really unfortunate consequence of the surge in the community. And the reason we had to reduce surgeries goes back to sort of the demands that are required for us to continue to be able to do surgeries. And that is our ability to have ICU beds, let alone regular telemetry or medical beds, our protected equipment, and testing available. And we're doing pretty well on our PPE and our testing, but I'll tell you, we've added one more category to the mix, and that is staff. So as the community surge increases, we have some of our staff that aren't available to work, and that translates to challenges staffing beds. So while we're prepared and while we have many options available to us in our toolbox, so to speak, we're getting stretched a bit with this recent surge. And I'm worried that what that's going to translate to 2 to 3 weeks from now.
All right, thank you, Robert. Anybody else?
Hi, this is Dr. Vovakes. I'm the Deputy Health Officer filling in for Dr. Ramstrom. today. And the other thing on these models that Robert was talking about are our mortality or our death projections. And again, these are just projections, but most of the models, if we continue the cases that the rate of cases that we're having now, would double the amount of deaths we have by Christmas. And there's one model that actually shows that would triple. So we've got in the 40 range now of deaths in Shasta County. This could go as high as 60 to 80, or even as high as 120, which is pretty daunting number to be even thinking about. That's all I have.
Thanks, Dr. Vovakes. Anything else to add? Okay, we are ready for media questions.
Well, those are some pretty sobering statements there. I wanted to ask Robert, I mean, just what you said kind of alludes to it, but what's the anxiety level now at the hospital?
Well, it's not anxiety, Mike. I mean, I think the reality for those of us that work in healthcare, this is kind of the norm. But to say that we don't look ahead and we don't have concerns, yeah, we're concerned looking ahead at Christmas time. And the reason the concern is there is sort of two or threefold. The first part is the fact that the more patients that we admit with COVID, the fewer patients that we can serve within Northern California. As you know, Mercy Redding sort of acts as this big funnel in Northern California. So we receive trauma patients from many counties, you know, roughly from the Oregon border to the coast to the Nevada border. The more beds that we have occupied with COVID, it makes it more difficult for us to respond to other emergencies in the community. Again, we have plans on how we can take care of patients should we get an inordinate number, but there are a few factors that are finite, and the human resource element at times can be a finite element, and availability of other critical resources can be finite at times. So really the ask kind of just goes back to, let's be sensible about our actions and our activities today, because it will influence what we see 3 to 4 weeks from now, or 2 to 3 weeks.
Is the hospital doing okay as far as being able to handle the number of patients coming in? Like, are we concerned?
Absolutely. No, again, this goes back to years of planning. And, if you think about how a hospital operates to a certain degree, we're kind of at one level of crisis mode from an outside perspective. There's not too much that actually rattles our operations, because we have to have plans or contingency plans should something occur. So I think I've shared before about our surge plan, that what happens next as patient volume increases. And we have that well detailed. It's quite operational right now. I will share with you that this week, as our hospitalizations have increased with COVID, we've had to utilize other areas of the hospital to care for specific patient populations. And it was really easy. It took us about 3 hours to make that transition to safely care for patients. And the beauty of the plan, and frankly, the beauty of our physical plant, is it keeps everyone safe. Staff, other patients that are here for other types of procedures, as well as the COVID positive patients.
Thank you, Robert.
You bet. Yeah, I don't want to give a sense that there's a panic. We're not panicked. This is part of our kind of controlled chaos, if you will.
Other questions?
Good morning. Oh, sorry. I just wanted to follow up on the testing. So do we know where the locations for the traveling testing team will be? I know it said like Anderson, City of Shasta Lake. And do we have a schedule of when they'll be operating?
So this is Robin. Yeah, so we do have 4 new testing sites that are going to be starting next week. They are all accepting appointments now, and so people can go to the LHI.care site, just like they would go to schedule an appointment at the college site, and all of those additional locations are listed on there. I don't know the schedule off the top of my head, but I know that there are appointments available on Saturdays and Sundays, as well as Monday through Friday. And the locations in Anderson, Shasta Lake, and the enterprise area of Reading are the HHSA's regional offices, but they are only doing appointments on specific days. So you have to go on and make an appointment online to go get tested at one of those locations. The other location that has been added is the Boggs building on Breslauer Way. So it's down near the public health buildings. And that site will be operating 5 days a week. And again, by appointment only. So go online to schedule your appointment, but it will be similar to the Shasta College site where it runs in that same location 5 days a week.
And then for the Boggs building site, when will that set up? And for the traveling sites as well, when will those be set up?
They are being set up on Monday, so they will begin testing on Tuesday of next week. But as I said, some of the locations won't have testing every day, so you'll need to go to the website to see which days are available at the different locations.
And then, thanks, Arvin. And then just a couple more questions. Do we know, because we talked about it last week, this was a resource we were expecting for a couple of weeks now. Do we know what was the reason behind, I guess you would say, the delay of getting these testing resources? Did the state ever explain why?
No, I never heard a specific explanation. I think that it just took them that long to get them rolled out with all of the different locations and to get the specifics, in place of where they were going and which days they were going to be at which location.
And then I know there was like 3 new testing resources. The other one was also for employers to help test workers. When can employers expect to receive those testing kits, or is that something they have to order on their own?
So there is a resource through the state called Color Kits that employers as well as schools can order on their own. I believe there is information on the state's website about that. And as soon as we get more specifics, we can roll that out. We've been trying to get some information from the state about what is required of either employers or schools or other settings that want to access those kits. We know that one of the requirements is that they have to enter into an MOU with the state in order to use those kits. So we're trying to get more specifics about what that looks like so that we can put that information out to employers and schools.
And with this new testing sites and resources, the county has been seeing a lot of backlog and some shortage in testing. With these new resources, will this help alleviate some of that testing backup we've been seeing?
Yes, absolutely. This is going to, in terms of just the Shasta College site, the number of tests that will be available through these state testing resources will triple what was available at the Shasta College site, because that site is already running 5 days a week. There will be an additional 5-day-a-week site, and then there will be the traveling team that goes around to these 3 other locations for a total of 5 days a week. So there will be a lot more capacity than there has been in the past.
So how long will the new testing site be up for, as well as the traveling team?
We have not heard an end date. We have not been given an end date. These are resources that the state is rolling out to localities, and the only possibility of them ending that we've heard is that if there's a site that's not being utilized to its fullest capacity, then they're going to want to move that to a different location. So if you can identify another location within your county to move it, they would do that, but otherwise they could pull it to give it to a different county. We don't anticipate that being a problem here, though.
People might want to know, is there a cost for this, or is it free?
It is free, just like the state testing site at the college. You go online and schedule your appointment. It will ask for insurance information, but if you don't have insurance, you can still access it. There's no copay. It's absolutely free.
Sorry, Robin, thanks so much for your help. And I just have a couple more questions. Do we know how many testing lanes the Breslauer campus will have?
It will just have the 1 lane, just like the Shasta College site. So they can do 165 tests per day, but it's spread out over 12 hours. So it's just one person getting tested at a time, but it only takes about 5 minutes to get tested.
And then I just want to make sure this was a county requested resource, correct? Like the county asked for this from the state?
Yes, the state provided us with a menu of different testing options, and we were asked to request the ones that we felt would work best for our community, and we received all of the resources that we requested.
Perfect. And I think that's it for me for now.
To confirm, could you repeat the testing site website one more time?
Yes, it's LHI.care. And you can also get to that website from the shastaready.org site.
Thank you.
Other media questions?
Oh, sorry. Actually, I do have something I want to follow up with. I know in the past there have been places that public health was keeping an eye on for COVID hotspots. Are we aware of right now any other COVID hotspots brewing out here in the county?
None that I'm aware of. I'm not sure if you're talking about geographic areas or like an outbreak in a particular, facility or something, but either way, no, there's none that I'm aware of at this time.
Okay, thank you.
Reading. Hey, Robin, while you were there, it may be yours, probably an HR question. With this number of cases, are we aware of any, like the county or the city of Reading, that are unable to operate efficiently because of the number of COVID cases? Are you hearing anything about that? Is that something you can talk about?
I'm not aware of any departments that aren't able to operate and do their normal functions. We do have, just like any other workplace, we have staff who are out either on isolation or quarantine. We are fortunate in the Health and Human Services Agency that a lot of our staff are able to work from home if they need to be out on quarantine. So that is an option for some of our employees, but no, I'm not aware of any departments, either county or city, that have, ceased services or anything because of staff being out.
Thank you.
Yeah, I had a question. The number of active cases is an estimate. Is that because of a lag in the reporting, or are they confirmed cases that have just not yet made it to the tabulation, or is that the great unknown of potential typhoid Marys wandering around that we've had all along?
No, it is an estimate based on the number of people who've tested positive and would still be within their isolation period or their infectious period based on when they tested or when their symptoms began. It's just that we are not able to do the level of case investigation and issue isolation and quarantine orders in as timely a fashion as we have been able to in the past because of the high number of cases.
Okay, so it's just a lag in the data gathering then.
Correct.
Okay, thanks.
Oh, I do have something I want to ask. I was looking at the state website yesterday and just wanted to know, the numbers there are not always aligning with the county numbers. Can you just explain some of the discrepancies there?
I can try, and Carrie may be able to add some detail here. So one of the differences is that the state uses episode date when they calculate our 7-day averages. And so what that means is when a test comes in, they don't necessarily assign it to that date that it came in. They assign it back to either when the person got tested or when their symptoms began, whichever is earlier. When we send out our daily updates, we're reporting the number of cases that came into our system on the previous day. So it's based on when we received it and not when the person's symptoms began or when they got tested.
Okay, I also just want to follow up because also when I was looking at the state website yesterday, it was also calculating as well the number of ICU beds that are available county-wide. Or would you say those numbers that the state puts out on the COVID website, are they accurate?
Robert may be able to speak to this one as well. I believe the state's data comes directly from the hospitals.
It does, and remember, Anna, that data is, I'm going to use Mercy Reading as an example. So we have 33 ICU beds that are in operation every day. And then we have 10 other beds that are on what's called a flex waiver. And we don't use them as ICU beds today. However, they're included in the data. And then any other area that we're able to identify as like an overflow area for ICU beds, for instance, we let the state know. So this is all about surge capability, surge capacity, that in a worst case scenario, what's our availability? And we're fortunate. We're fortunate on the West Coast. We're fortunate here in the North State that we have a good supply of ICU beds. There are parts of the country that don't.
Okay, thank you for explaining that. Yeah, I just wanted some clarity on that.
Any other media questions?
One more quick one. There seems to be a lot of technical difficulties with the numbers. Is it just because of the number of cases now? You know, it just seems like, you know, that we're backed up. There's changes. What is there one source of that? Is it a lot of different things?
I would say it's a lot of different things. One is just that there's such a high number of cases right now that it's just harder to manage. But we also have issues like, you know, over the weekend, as Carrie mentioned earlier, where the state did something to some kind of an update to the system. So numbers that would have come in on Saturday didn't come in until Sunday. So things like that happen on occasion. There are also some labs that are not reporting electronically directly into our system. So some labs send us a spreadsheet or they fax individual lab results, and then we have to enter them into our system in order to process them the way that we do with others that are entered directly into that system. So it's a variety of things.
All right, thank you.
All right. Any other media questions? Or anything else that any of you would like to add? All right. We wish you all a very safe and healthy Thanksgiving. We will see you all again next week. Stay safe, everyone.
Thank you. Bye.
Thank you.
Thank you. Happy
Thank you.
Thanksgiving.